Good morning, everyone. We are just going to wait a few minutes to get everyone in. Thank you again for joining us. So just give us a few minutes and we will start the presentation. So, good morning. My name is Deborah Levine. I am the director of the Harlem Health Initiative. And I welcome you all today to joining us for this exciting webinar and being able to share with you some of our data that we have been able to gather together around police perspectives, mental health, substance use, and community safety during COVID among Harlem residents. I'd like to remind folks today that this is really us reporting back on the survey data. We've received a ton of questions from you all, and we appreciate your input in this conversation. There are some topics today that we'll be able to cover that are based on the data that we have been able to accumulate. Some of the conversations and some of the questions that have been posted will help us design future town halls and webinars. So we ask that you are patient with us today as we put this information forward. We want this to help us guide the conversation and what we can do as we move forward as we are working on attitudes, knowledge, and beliefs in our community and to support the initiatives that are currently existing. You'll see that there is a poll up, and we would love to know what brings you here today, what organization you are working with. Please also know that we have the chat open, and so we will be looking to make sure that we get all of your questions in. And if we don't answer them today during the presentation, we plan on sending out an update along with the link for this webinar as it is being recorded. So I'll just give us a few more minutes to allow people to come on in and to answer the poll before we begin. It gives me great pleasure to turn the floor over to our presenters this morning. Sam, if you give us one more minute, we should be able to share the results.
Great.
So it looks like we have about 56% of our folks are from community-based organizations. Thank you for joining us. We have some of our faith-based organizations also participating in this conversation today, along with our community members, community educators. Happy to see that our mental health providers have also stepped into this space along with our students. Part of this work is also to help us support the next set of public health leaders by working with our students to encourage them to be more community-centered around the work they do. So thank you very much for answering the poll, and we will stop sharing at this point. As you can see, here is who is in the room with us. Sam, I turn the floor over to you.
Okay, just a quick question. If I hit X on this poll, it's not going to do anything to you all's
Nope, you're good.
background. Okay, great. Hi, everyone. I'm Samantha Weckesser. I am a fourth-year doctoral student here at CUNY SPH. I'm in the community health and health policy specialization. I've worked with Deborah and Pedro, as well as Dr. Vicky No, on the Harlem Strong project for the last 4 years in various different capacities, and I'm excited to be here today. Pedro, do you want to present yourself really quick and just introduce before we go in?
Yes, good afternoon, everyone. My name is Pedro Mateu-Gelabert. I'm an associate professor at CUNY School of Public Health. Most of my work in the last 25 years has focused on substance use and the impact of substance use on people who use drugs, HIV, and hepatitis C prevention. I also did some policing related work in my early days at Bureau Institute of Justice, specifically addressing civilian complaints and policing practices in the South Bronx. I'm very excited to be here. I'm looking forward to a conversation on this very important topic. Thank you, Sam.
Yes. All right. So let's jump in. So again, good afternoon, everybody. Thank you all for taking the time out of your day, especially if you're on your lunch right now, to come to our presentation. So we're going to be talking, as Deborah said, about some of the findings from our Harlem Strong resident survey that was done as part of a community needs assessment back in 2021. So we're going to specifically be speaking to our findings that pertain to police perceptions, mental health, substance use, and community safety during COVID-19. And so specifically today, we're going to discuss what the current research on perceptions of the police in the United States is saying. We're going to speak briefly about different methods we use to collect our data. And then Pedro is going to go into our findings on specifically what the police perceptions and community safety perceptions are among Harlem residents. After that, we'll hope to have a discussion and answer some of your questions. Since the scope of our data is a little bit limited, we may not be able to answer all of your questions, but we'll try our best. We'll also take the time to put together some written responses afterwards to any questions that you might have that we might have the answers to if we just do a little bit of digging. So please feel free to ask about any of that as well. And we'll send that around afterwards. And so let's start off with discussing the current state of research on the topic. So while there has not been very much research conducted on the way that community members, and when I say community members, I mean lay folk, so just people who live in the community and experience day-to-day life and policing, either passively or who have had interactions with the police directly, but who are not themselves researchers or in law enforcement necessarily, feel about police who provide services to their neighborhoods. The research across the board that's been done overwhelmingly shows that Black and African Americans are more likely to have negative perceptions of police and policing behavior when compared with white or Latinx Americans. And this is true across all genders. This graphic here is from a 2016 Cato Institute study that also looked and did this and controlled against gender ideological parties. So it compared Democrats to Republicans, and I believe it also included independents. And it also looked at socioeconomic status. And again, across the board, this held true. And this was a study that was done very similarly to, if you're familiar with CUNY's COVID study, where they took a panel of 2,000 American adults from across the country. But the reason I'm showing this graphic specifically is because this is true across all of the literature, right? So usually you see some variation depending on what kind of tool was used or how the information was being collected at the time. But we see this, and these numbers hold consistent within 2 to 5% among all of the studies that were done on this topic in 2010, which is pretty telling. And so 73% of Black and African Americans surveyed, and this again is from that same Cato Institute study, but I want to mention again that this is true and holds true across the board. I'm just citing this study because it has the biggest sample size, and I feel like it's most applicable to the research that our team at CUNY and in Harlem Strong has conducted. So that's 73% of Black and African Americans that were surveyed believe that the police are too quick to escalate to the use of legal force. And that's compared to 54% of Latinx Americans and 35% of white Americans. Again, this is not entirely surprising. And again, holds true within, a very small window of percentage points across all of these surveys that were done at the same time pre-pandemic. There aren't that many studies that have been conducted or that have been published yet that have come out post-pandemic. Well, obviously the pandemic is still happening, but post-2020 with all of the protests that took place that summer. And so the same survey, and this is holding true again across all of the different races, ethnicities, genders, socioeconomic status, and ideological party. So 65% of Americans surveyed, and again, not just this one study, but across the board in studies that we looked at between 2010 and 2020, believe that police officers regularly racially profile Americans. And while this definition can look a little bit different when you're looking from study to study, this study and most others use racial profiling in the way that most of us probably conceptualize it, in which the police purposely or unknowingly, but have some sort of bias against Black and brown folk, and as a result are more likely to either use excessive force or we're in a situation where they may let a white person off, continue to, go down a rabbit hole with the person that they're looking at. And so also important to note before Pedro gets into our research specifically is that the majority of the current research that has been done and that is currently being done examines the impact not of perceptions, but on traumatic interactions with the police and mental health. There isn't really too much out there that looks at the relationship between having either positive or negative perceptions of the police specifically and specific mental health outcomes, which we think is very important and something that should definitely be taken into account, especially with the knowledge of epigenetics and the way that trauma and living in a constant state of chronic stress can impact folks not only health physically but mentally as well. And so I kind of alluded this before, but the most recent research has been conducted in 2016 and 2017. Additional large-scale studies like the one that I'm citing from have been done with the Department of Justice and the Vera Institute. But again, this was back in the early 2000s, so pre-2010s, pre-pandemic, and 1990s. So there's clearly a big gap in the scientific literature and in research that's really looking at what the mental health impacts of, simply existing and having this perception of the police are on folks, which again is something that's really important and something that has likely changed over time, but is not being adequately captured with the tools that currently exist. And so that is to say that what's probably the best validated measure currently that examines community perception of police and policing activities is called the POPS, which stands for Perceptions of Police Scale. It's one of the most widely used tools because it has been validated in multiple studies and has been most often combined with things like the PHQ, the Audit C, although less so, and the GAD-7, which look at depression, anxiety, and substance use specifically, and are also the measures that we use in Harlem Strong that Pedro will talk about after I'm done. And so specifically, what I want to get into when talking about this scale, and the reason I'm spending so much time on this scale in particular is because it is the most widely used, and it is one of the ones that is most close to the one that Pedro and Dr. No developed together for this project. And so it was designed specifically to measure attitudes towards law enforcement and beliefs about police bias in the community. And it's 12 statements that include things like police protect me, police are friendly, police treat people friendly in my community, they don't discriminate, and most tellingly probably, police care about my community. And these are all, like I said, asked on a Likert scale, that's 1 to 5, from strongly agree to strongly disagree. So again, kind of similar to what we did. It doesn't contain any specific questions about mental health, substance use, or any of that. Specifically doesn't ask for questions about anxiety and depression, but has been combined in the literature quite often with, again, different versions of the PHQ and the GAD, which are pretty much the gold standard for measuring depression and anxiety among folks. This was also evaluated specifically with historically marginalized folks, and has been validated to be used with the PHQ-9 and GAD-7. So all of this is to say, this is kind of the groundwork that informed our development of the measure and how and what's currently out there and being done. And so now I'm going to talk a little bit about our survey specifically and why you're all here. So in order to accurately measure the different stressors that were contributing to negative mental health outcomes and what we believe to be increased substance use at the height of the pandemic, the Harlem Strong team, with the help of Deborah, who is fantastic, and Dr. Punter over at Harlem Congregations for Community Improvement, we tapped into their networks and their rich connections within the community in Harlem to advertise this survey. And so we did that through different CBOs, all 3 Manhattan community boards that cover Harlem. And so we had pretty wide representation there. We also, blasted it through social media and of course, word of mouth. And important to note here that survey participants who met our completion criteria were provided with $20 Amazon gift cards that they could use to buy food or whatever they wanted after they completed the survey. And so I've kind of alluded to this, and Pedro will get more into it, but the resident survey was developed using a combination of new, including this measure, and previously validated measure tools. It was administered digitally via Qualtrics. Folks took it on phones, computers, tablets, for example. We didn't do in-person outreach for our resident survey the same way we did for other aspects of this needs assessment because it wasn't safe at the time. We didn't want to put anybody in danger or put ourselves in danger. So that was the reason why we administered the survey this way. And the data was collected from April 13th, 2021 to September 16th, 2021, which is also important to note here. All of our data was verified manually by the research team. We developed a very stringent set of criteria to determine who was real versus who was a computer taking the survey just to, get gift cards, because that is a relatively common scam that popped up during this time and was happening with a lot of different surveys, not only ours, but within all of the studies pretty much that were doing digital surveys at CUNY. And then from there, we took the verified respondents, paid them, obviously, and then analyzed our survey data using Stata and SPSS. And so now I'm going to turn it over to Pedro to talk more in depth about what our findings were in terms of police perceptions and community safety.
Thank you, Samantha. Okay, let me share my screen. Is everyone seeing the presentation?
Yes. There we go.
All right. Thank you, everyone. It's a pleasure to be here. So I'm going to just jump in terms of background. So during the COVID-19, there was a very parallel situation regarding social unrest and social protests regarding policing. And that led to the merging of the critical movement, social movement of Black Lives Matters. And in the process of working for Harlem Strong, we thought it was very important while we're exploring the impact of COVID-19 in the community, Harlem community, to also explore how that kind of parallel aspect of policing, whether or not it had an impact in the community. So we examined the association between police perceptions, substance use, and psychosocial factors during COVID-19. A little bit of methods. Samantha has already addressed some of this. I'm just going to reiterate it. We did an online survey of 398 adults living in Harlem, conducted from April to September 2021. And we inquire about policing, mental health using the PHQ-4, alcohol misuse using the Audit C, marijuana use, and community safety. And we developed a 10-item questionnaire asking residents' perceptions about police responsiveness, safety, and racism. Response options were a 5-item Likert scale from agree or strongly agree, neither, disagree, or strongly disagree. Now, this next item is very important. In order to determine the total score for the respondents, we dichotomize agree, strongly agree as 1, and neither agree, disagree, or strongly disagree as 0. And there were 5 items that were reversed when calculating the average total scores. Higher scores in this analysis indicates more satisfaction with the police, and the score ranges from 0 to 10. So say somebody scores a 7, indicates a higher satisfaction with the police that somebody say scores a 3. Then part of the analysis I'm going to present here, we explore the correlations between perceptions of police using bivariate and multivariate models. Now, here I'm going to present the overall scores as percentage to give a general sense of what is the content of those 10 items we develop and how they are organized. So for example, I'm going to go through each one of the items. The first item states, the police are responsive to calls from my community. And we have here, notice here, percentage who disagree or strongly disagree. So we have 23%, close to a quarter, who disagree or strongly disagree with this statement. The second statement is, I feel safer when I see police presence in my community. Again, a quarter disagree or strongly disagree with that statement. I find police to be helpful in managing crime in my neighborhood. 27% disagree or strongly disagree. The police are equipped to deal with mental health issues, a higher percentage, 30% disagree or strongly disagree. And then the police has been respectful and responsive to the needs of demonstrators, 35% disagree or strongly disagree. Now, these are the next items are items that were reversed when for the summary scores were calculated. So here we present the percentage that agree or strongly agree. The first statement is, I feel unsafe when I interact with the police. 27% agree or strongly agree. I feel, sorry, I missed the first item. My community will be safer with fewer police. 27% agree or strongly agree with that statement. I feel unsafe when interacting with the police. 29% agree or strongly agree. I feel safer with fewer police. 30% endorse that statement. The police in my community behave in racist ways. A whole 32% endorse that statement. And someone in my household was unfairly stopped by the police. Again, close to a third, 32% endorse that statement. Now, we develop a little bit of a scorecard, if you will, where a whole, again, remember the lower the score, the less satisfaction with the police. And here we have 46% provide a total score from 0 to 3. 43% had a total score from 4 to 6. and 11% had a total score of 7 to 10. And again, the higher the score, the more positive perception regarding the police. These are based on items positively endorsed, and very important, and those items participants agree or strongly agree. For questions regarding negative perceptions, the results were reversed. All endorsed items here denotes a positive police perception. Now, I'm gonna present a little bit who have responded the survey, and in bivariate analysis, whether or not there is correlation between perceptions of police and some of these social demographic variables. Let's start with age. So here, so you're curious who these 398 people, close to 400 respondents from Harlem are. We can tell you that 32% are ages 18 to 29, close to half are ages 30 to 39, and close to a fifth, 19% are 40 or older. Now, what is interesting in bivariate analysis, age, younger people, you could see, are more likely to have a lower score, less positive perception than the police, than the people who are older. Regarding gender, similarly, we have 57%, so a majority being women in the survey, and 43% being male. Again, women are more likely to have a higher perception of the police, and that's significant. Now, this here is where it gets interesting, and is a little bit dissimilar to what Samantha has presented. We have 49% who are African American, 32% who are white, 12% who are Latino, and 6% who are Asian. However, and this is very important, worth noting, in contrast to what Samantha has stated for other surveys, race here, or ethnicity, is not significantly associated with perceptions of police. So in other words, there are not significant differences, say, between African Americans, whites, Latinos in their overall score of, and that is for the Harlem residents. So that I think is of great interest, and I think is something worth exploring further. Now, so regarding marital status, we see people who are married are significantly more likely to have positive perceptions about police than those who are not married. And then regarding educational attainment and employment status, we start seeing a bit of a pattern where people who are less educated, meaning formal education, meaning those who have high school or less in terms of formal education, have a more higher score, more positive perception than the police, than those who hold a associate degree or a graduate degree. And we can see that the direction goes, the higher the degree, the lower the score regarding perceptions of police. And the same goes for employment. Those who are unemployed, and this is again interesting and perhaps a bit surprising, people who are unemployed are more likely to have a much higher score regarding perceptions of police than those who are employed full-time. Again, interestingly enough, in terms of socioeconomic status, one might think, well, education attainment has an impact at bivariate level, but income does not. In other words, independently whether or not you make less than $25,000 or you make between 50 and 100,000, or those scores are not significantly different. And you can see a little bit the socioeconomic status of our respondents, with close to a third having an income less than 25%. Half of the respondents have an income between 25 and less than 50,000, and 20% have an income higher than 50,000. Now, then we wonder, and this is something that is, like Samantha say, is just a beginning of an exploration. As you know, mental health has become in the forefront of our nation and our city, rightfully so. And we wonder, and it was a basic empirical question: are people with different depressive scores in terms of depression severity, is that mental health status, if you will, associated with different perceptions regarding policing in the community? And interestingly enough, at the bivariate level, we see that people with depression scores, either mild, moderate, or severe, are significantly more likely to have lesser positive perceptions of the police than those who present none or minimal depression. In other words, people who are depressed to some degree are more likely to have a less positive perception of the police, or the policing in their community, in this case in Harlem. And that pattern also kind of repeats itself for people who are not at risk for anxiety, also are more likely to see the policing practices with a more positive light than those who are at risk of anxiety. So that is intriguing. I think it's, we don't quite know the mechanisms, but I'm going to talk a bit more about that in the conclusions. Regarding alcohol misuse, people who don't use alcohol engage in alcohol misuse in the past year have a higher score regarding a police perception than those who did. And this initiating or increasing marijuana during the pandemic, we see that those who didn't have a more positive perception regarding police. And now we were wondering, well, is that perception of policing practices, policing perceptions about police, is associated with how one sees the safety of the community? And again, significant in that we see that this is at the bivariate level, and then we're gonna put all those together in a combined model to see the. But I found interesting, at least at the face value of this finding, in that people who feel the community is safe or extremely safe or very safe have a higher perception of the police than those who feel the community is extremely or very unsafe. That's not unexpected. That somehow the respondents, there is perhaps an equivalency regarding perceptions of police and perceptions of safety within the community. Now, that was at the bivariate level, meaning each variable with the police perception. Now we put all together in a combined model for accounting for how the variables interact for each other. And this is what kind of remains significant in this multivariate model, where all the impact of the variable is accounted while seeing whether or not other variables have an impact in the overall model. So what remains is that young people, the second line here in this spreadsheet, the younger people who are mildly depressed, moderately depressed, or severely depressed, and people who ever use marijuana are more likely to have lower scores about lower perceptions of police than those who are older, not experience any depression, and never use marijuana. So what do we make of this in terms of conclusions? Large percentage of Harlem residents have negative perceptions about police. About a third believes the police are not responsive to community needs, behave in racist ways, and are not equipped to deal with mental health issues. Now, regarding how that perceptions are associated with some social demographic characteristics or mental health characteristics, Harlem residents who are younger, mildly, moderately, or severely depressed, and ever use marijuana have significantly lower perceptions about police. Now, this next bullet is also of interest in that we found no association between police perceptions and alcohol misuse, perception of community safety, and race or ethnicity. We think this is kind of opening very interesting research questions. And one of them, most critical, is we need more research in kind of inquiring how police perceptions might have an impact on mental health. Also, we would like very much to move forward in the direction to better understand how policing practices impact communities and how best ameliorate his negative impact on community well-being. Last but not least, certainly to acknowledge all the close to 400 community residents that took the time to answer the anonymous survey, and the CUNY Interdisciplinary Research Grant, NIH Research, Health Disparities, and the Robert Wood Johnson Foundation, and Victoriano, and Deborah Levine for the PRship in this project. I'm going to stop sharing. Thank you.
Pedro, Sam, thank you so much. This information is, I don't know about the folks in the audience, but hearing from our community and having a better sense of what the perception is and what was happening during COVID has been extremely helpful. We do have a question that's come in. We will open for questions, so please feel free to drop them in the chat, and we will do our best to answer them. The first question I have is, how do the perceptions of the police and members of the community compare? And I don't know, Sam, if you want to take that, or Pedro, or if it's some combination.
I can speak to that a little bit generally. We don't have, so I will preface this by saying this is just one small part of a larger survey. So our survey didn't seek out, we don't have a version of the tool that they developed for police. So we were really just trying to understand better what the Harlem community was feeling at the time, and didn't reach out to, for example, like NYPD members and employees. That said, though, there has been some research done generally on police perceptions of the community itself. There haven't been anything specifically in Harlem, or actually, interestingly enough, recently. But those are something that I can type up and send around in an FAQ, because I don't have like the numbers off the top of my head. And they are a little bit older. So I will say the most recent study I saw that was looking at like the reverse, so police perceptions of the community itself. I think the most recent one I saw that was of a population similar to New York City was one that was done in Philadelphia. It compared Philadelphia to, I want to say, Chicago, and it was done in 2012. So I can pull that for you and send it along with any other questions we don't get to today, and Deborah can send them out with her team afterwards.
Thank you. Do we have any other questions from the community? Wow. If you'd like to raise your hand or unmute, we would be happy to see that.
Oh,
I have a hand here. Hi, Orbit. I see you.
Yes.
Please.
I want to say thank you. That was really informative. A lot of the information wasn't shocking to us, but I want to ask, given the skepticism of interacting within the Black community, how are there any call to actions that we could do to change that? And what role can our faith-based organization, churches and mosques do?
So I will start that conversation and then pass it over to Pedro. What I would also say is that this survey came out of the work of Harlem Strong, which is the mental health initiative that we're working with Dr. Punter at Harlem Congregations for Community Improvement, our elected officials here in Harlem, to look at anxiety and depression and to create a coalition to work with community health workers and associations and community-based organizations to, one, address the stigma attached to mental health, in particular around anxiety and depression, to create a training mechanism so that we can create safe spaces to have those conversations about anxiety and depression, and also to work on a loop of referrals so that providers in the community can hear the voices of community members and also work through a mechanism that we can strengthen referrals. So what I would say, Orbit, is that please come join us in the coalition work, because we know that this is critical in terms of involvement and creating safe spaces to have those conversations. What I would also say is tap into the trainings that we will be providing. We'll also be creating spaces where our partners who are doing some of this work in the community will also be doing trainings and town halls, so that, again, we have a documented process about what the issues and concerns are, so that collectively as a group, we can work on solutions. I would also turn that over to Pedro to answer.
yeah, thank you for the question. And I agree. It is very important to kind of take the results there. Clearly, when you have one critical part of local government, like policing, where about a quarter to a third of the community residents are unhappy with the practices. And even in that quarter or a third, feel they are better off without that service. That clearly puts into question why is that? Why that such critical service that is set in place to serve the community is perceived by close to a quarter to a third as a service that doesn't serve them, a service that they feel unsafe with interacting with the police members. So how the community can address that, I think Deborah and you are better equipped than myself. I think a dialogue between the police department and the faith-based communities, to Deborah's point, is critical. And one in which perhaps behind closed doors, behind very sincere dialogue as per why do community members, community-based organizations think this is going on in the interaction with the police, and how that community interaction can improve. On the other hand, I think it's worth noting that, yes, close to a quarter to a third are unhappy about those services. That means that close to 75 to 70% are happy with those services. And I think exploring further what is going right, what kind of things are being done right, and how some of those practices can be extended to the rest of the community, kind of acknowledging the good work and seeing how things can improve also could have a lot of kind of positive step forward. Clearly, there has been a lot of discontent, say for stop and frisk, that was found to be not a good practice within the police department. So there is clearly a history of animosity, but I think I found also very interesting that kind of different kind of how the perceptions are less, well, actually that didn't remain at the, so I'm very curious how this aspect of mental health and policing interacts. I don't know if that's a direct effect or is an indirect effect. For example, the fact that young people are significantly less likely to perceive the police under a positive light, that also is a room for improvement, for dialogue, where younger community members can speak with police community, police leaders and police community interaction members, how, if and how, why is happening and how that can be improved. Again, certainly to your point, Orbit, I think there is a lot of work that can be done, and an ongoing dialogue certainly could work a long way.
Thank you. Reverend Dr. Gail Badger.
Good morning. Good afternoon. I think this was a wonderful discussion, and I'm glad that somebody is finally taking the reins to bring these things to the forefront. My question, I don't really have a question, but the 75% of the people in Harlem are happy with the police. I question that. I mean, if the numbers bear it out, then it is what it is, but I question that. But on the other hand, we have a perfect opportunity to take this to 1PP and make a point. If we can validate the numbers, we have a very good opportunity to do that. You have a unique situation where you have a minority police commissioner, which we hadn't had ever, that really, to her point. and we have a minority mayor who both seem to be very interested in healing the wounds within the community. So I think on some point, yes, the communities need to be involved. Yes, the churches would probably cooperate in any effort to bring peace between the police department and the community. But I think it has to start at the top. We have to start with the grass. That the police department has to start with the mayor's office and his special envoys to the communities, and then trickle down maybe through the CPOC system in the police department, and between the different associations in Harlem, different CDCs in Harlem, where we have an ongoing dialogue, like the gentleman said, where we can kind of hash out these problems. Because I be honest with you, my young people don't want to know nothing about the police department, and some of my seniors don't want to know either. And to be honest with you, I was stopped twice going home, and I said, do I look like a criminal? And the young man said, well, you come this way every day. The police officer said to me, you come this way every day. Maybe you should find a different way to go home. I should change the way I go home to get you to stop in my car. I don't think so. So I think the attitude of some of these police officers needs to be addressed. And I think this can be a foundation from which we can then go and use that information that we have gathered to address this situation, because I don't see it getting anything but worse over the years to come. That's just my opinion.
Thank you, Pastor. We appreciate that, and we will definitely include that in the notes. Deacon, I see you up in the corner, and then after that, I see Tracy Gardner. So I will yield the floor. Deacon?
Yeah. My question is, this survey, does it line up with surveys that were done during previous administrations? Let's say, Pedro, you mentioned a stop and frisk. And it mentioned stop and frisk. That was a regime and an effort to have things done a certain way. I would suspect that these statistics are vastly different now than then, or maybe it's not. But if, the statistics are great, but how do you interpret the statistics based on what works and what doesn't work? Is there a way of doing or has it been done for a correlation for what happened before? Same question. What's happening now? Same question. Has confidence improved? Has it gone down based on the policies that were happening then and the policies that are happening now? Or are they the same? Have we gotten nowhere? I think we talk a lot about these things because inherently, we're most of us are logical folks and you figure things out, but what's working? And I think that needs to be looked at, because those things can be addressed right away easily. If there are 3 or 4 things along these surveys that are drastically different than another time, that worked. That way, and even while you were going through it, you mentioned a couple of things. Oh yeah, this is why. I think we have to simplify, the results and the comparisons to make the discussion better, and to get to the Reverend, and I'm sorry, I've known Gav for a long time, to Reverend Badger's, Dr. Badger's point, address it to the top, because they have no time to think through all of these things. We have to hit them hard with things that count, that's measurable, says, oh yeah, really, stop and frisk was that bad, but what are you gonna do about it? Police precinct work, policing, work. Well, why aren't we doing the same things now? Community policing, or did it not work? Or should it be done different? So I think that's what I would be more comfortable sitting at a conversation having, with things ground down to the real differences and what works and what doesn't.
Thank you, Deacon.
I want to agree with you. I think that you're making several points. One is the continuity regarding satisfaction with the police over time. To my knowledge, those surveys don't exist, which makes it very hard addressing your point to see whether or not certain policies, certain changes, how things improve or don't improve over time. I think that's an excellent, brilliant idea. To my knowledge, I don't know that police prisons do that in a systematic basis. I know that ComStat uses several measures regarding policing activities, say number of robberies, number of homicides, statistics on crime. Again, the idea of including a survey, a community survey of police satisfaction, and redoing that survey over time, Deacon, I think would address your question in a more systematic way. One common say in social sciences is that one survey, one result doesn't give you a trend. So it's very, very hard for us to speak of trends here. Also, I agree that in the current leadership, the mayor and the police officer on the top, being African Americans, is a unique critical opportunity, to the pastor's point, of initiating an ongoing dialogue. So Paul, again, I think you are certainly more of experts than myself here, but I want to fully endorse those suggestions. It seemed very, very good suggestions.
Hey, Tracy Gardner from Legal Action Center. This has been an absolutely fascinating presentation for me as a former Harlem resident, and also in terms of the drug and criminal justice policy work that I do, and have been working with folks like Deborah Levine, serving the Harlem community since the early days of the HIV epidemic. And so a couple of things occurred to me in hearing the presentation, one of which, because it was ComStat was just mentioned, which is looking at this information with a geomap, some kind of aligning geomapping, because some of the associations don't make sense to me. I think the pastor mentioned earlier, it's kind of, it's hard to get at the individual experiences when they're part of an overall survey. But I think even different places in Harlem have different experiences interacting with law enforcement. The second is about kind of the discussion about the role of law enforcement and the police around two issues that have been over-policed in particular, and that is substance use and mental illness. And so it's really, really, it doesn't give us a real true sense, in my opinion, of when we have a hammer and that's all we have, we're going to use a hammer as a response. We have not looked at the array of other engagements and approaches to the communities hard hit, particularly post-COVID, with drug addiction and with serious mental illness. There have been lots of conversations, obviously, in Harlem about the kind of the disproportionate number of services that are based in Harlem. And I can, continue to suggest that we look historically at the fact that Harlem real estate was cheap, and those are the programs that had the leases and the money to be able to buy the property. And so over the last 40 years, the changes in Harlem have had very little impact on those long leases that those service providers, particularly around addiction and mental health, secured back in the 70s when nobody cared. Which brings me to the Black leadership, I think is even is a challenging opportunity, because Black communities like Harlem have not been able to have the hard and painful discussion about the fact that people with serious mental illness and people struggling with drug addiction are also our community members, our mothers, our fathers, our brothers, our sisters. And until we reconcile with that and the criminalization of drug use and serious mental illness, we're not going to be able to develop strategies that really get at what's going on. Because we cannot revile elements of ourself in the community. People say folks are coming in from outside of Harlem, access to services, but fundamentally we're talking about the health of the Harlem community, and that means recognizing the things that challenge the health of the community. So I just wanted to put those thoughts forward. I'm very grateful about for this work that's happened. And thank you, Deborah Levine, for your longtime leadership.
Thank you, Tracy. And to all of your points, I think that is really why folks like Dr. Punter from HCCI and others, when we started to talk about anxiety and depression in the Harlem community, not just of the community residents, but also of the staff who service the community-based organizations who were already overwhelmed before COVID. And COVID just ripped that nasty Band-Aid off. And we're hoping that as we're developing this coalition, that this not only will talk about anxiety and depression, but will create this space to be able to use this data to create spaces to have other hard conversations, because we know that unless we talk about it and put it out there and use this data in a way that it's not about always knocking somebody in the head, but being able to come up with positive solutions. And we've got to do that as a collaborative, as every part of the community. It can't just be from the bottom up or the top down, but really that collective. So yes, to your point, Tracy, we recognize that this is not the end all, and that it is very difficult to extract information out of a larger survey, but we wanted to take the time to at least begin to lay the foundation for this next set of conversations. And how do we move the needle as we go forward? And we hope we can call upon you and the work at Legal Action and the other advocates and community experts here as we are creating the space. The School of Public Health wants to be able to create the safe space so that those conversations could be had. We don't necessarily want to say that we have the answers, but we are willing to work with all that are willing to work with us. Pedro,
And-
did you have a response?
Yeah, just to reiterate what Tracy has said. One, yes, it will be, I think your point about geocoding is a very good one. This is our first survey exploring these areas. I do not think we have, because it's an anonymous survey. So certainly to your point, to establish differences across different addresses within Harlem certainly is an area of importance. Also, your second point regarding whether or not policing is perceived differently by people who use drugs, I think that's also an excellent point. What this survey does confirm that people with a history of marijuana use are more likely to have negative perceptions of the police. And a third point that I think you have made, and a whole third of the respondents agree with you, is that the police are not equipped to deal with mental health issues. A whole 34% think that. So again, I think a lot of your points are well taken, and certainly encourage future graduate students like Samantha, or current graduate students rather, future researchers like Samantha, or my doctoral students to pursue this area. Also, I think you make a point that's kind of brewing here, but I want to make explicit. There is very little research about how policing impacts the mental well-being of community members. I think that's a new direction. Samantha has, in her research, has determined that is very little to explore, meaning to have been explored in that direction. It's certainly something that we would like very much to start thinking about it. I encourage my graduate schools or my fellow professors at CUNY to start thinking of policing as an aspect that directly impacts public health. There is this amazing work, of course, of Michelle Alexander and other researchers who clearly established the huge, long-standing impact of criminal justice and substance use policies on the historical impact in terms of incarceration and other negative impacts on the community. So we have not fully explored the aspects of substance use here, but certainly something, to Tracy's point, that ought to be pursued further.
Thank you. We have a question from the audience. New York City recently instituted policy changes to have NYPD identify mentally ill residents and forcibly institutionalize these residents in psychiatric hospital facilities. Do your results regarding distrust of the police among Harlem residents with mental health illnesses have the implications for this policy? And do you have any plans to use the results to advocate against the policy's changes? So I think, Pedro, before you and Sam answer this, what I will say is that we want to be very clear that this survey was done before this policy change was in place, so that the data that we have does not reflect the current policy change. So I just want that to be noted. This information and the data that we do have will be shared both with our elected officials and those that are interested in using it for advocacy purposes. So Pedro, Sam, I will turn the floor over.
Yeah, I think it's important to keep in mind the time frame, like Deborah said. So the survey was administered from April 13th, 2021 till mid-September of 2021. So that was while this idea was kind of, if you were following the discourse, it was bouncing around, but it hadn't been implemented or spoken about like in a public forum at that point. So this, for starters, it's probably something we would have included had it happened at the time. But our data, I don't know that could be manipulated in a way with which like we could use it to advocate against it. I wish that was different, but for right now, I think, and Pedro, I don't know if you agree, but that's kind of the way that I look at it. I think there's definitely room to include, because I think that's definitely something that should be looked into, but.
Well, I do think that to the person who addressed the question, I think there is two data points that could speak to the potential impact of that policy. One is, like we were addressing earlier with Tracy, that a whole more than a third, 34%, does not think that the police is equipped to deal with mental health issues. So that's a data point worth considering when we think about that policy. In this one survey, a whole third of the respondents do not think that the police is equipped to respond with to mental health issues. The second data point that speaks directly to that policy is the fact that people who are experiencing mental health issues, either depression or anxiety, are less likely to see the police on a positive light. Again, that speaks directly to that policy. If people experiencing mild mental health issues, such as depression and anxiety, are less likely to see the police in a positive light, and that's an empirical question, but a reasonable follow-up question, what is the perception of police for people who are experiencing severe mental health issues? all these are very legitimate questions in light of that policy.
Thank you. Gordon Mohammed, I see you have your hand raised.
Hey, can you hear me? Hi.
Yes.
Hey, happy New Year, everybody. No, I was just inputting in because I work in the homeless outreach unit, and I've been assigned up there. I just think the percentages numbers may be a little bit off, or whatever the case be, however the survey was done. Because just being assigned there in the area of Harlem, dealing with the public and the residents, they're just very upset behind what's going on. I mean, I even got pulled into situations where, hey, I'm not a cop. I can't help you. I can't do anything, where it's just so much drug abuse that's going on. And granted, you can't mix mental health with crimes. You just can't. It's just two different things going on, where somewhere in between it, there's got to be equal. But it's just a lot. It's just a lot to go on. There's no really good answer behind it. But since the bail reform and the lack of the policing and reform, this is going to be going on until they get it straightened out. Just being in Harlem alone, you got like 10, 11, 12 methadone clinics. You got people coming from Jersey. Just the other day, I met 2, 3, 4 people who don't live in Harlem coming to buy crystal meth. That's insane. That's insane. And it's a lot. And I do agree that NYPD, some of them are not equipped to train and handle mental health, but that's something that they have to get on the board with. A lot of crisis training, meeting with the community, a lot of community relations. But I definitely say there's not the percentages and numbers are off. Just being there on. You call 911 for a situation, the person in cops is going to say, "Oh, I can't do nothing." So what are we trying to do? Supposed to help the community and also help the vulnerable population.
Thank you for your comment. We appreciate that.
Just to react a little bit, I think your points are well taken. I know in the Harlem community, there is this ongoing discussion regarding services for people who use drugs, say methadone clinics and other services, and whether or not the Harlem community carries an unfair burden of the availability on these services. Most of my work is on substance use. So and this is a personal opinion, informed by my research, I do not think any service for people who use drugs or with history of drug use are detrimental to the community. In fact, I think they are historically have had a huge positive impact. Say you want to think on needle change programs, how they have managed and reduced the HIV risk of people who inject drugs, and therefore to the community as a whole. Say methadone clinics that serve people who are struggling with heroin or opioid dependency, and the methadone helps them manage their opioid dependency. So I think it's important to differentiate the pill markets, the drug markets that exist in Harlem, but I do not think that harm reduction services or drug treatment services trigger or initiate or enhance the existence of drug markets. I think it's different aspects of what serves the community, that's what serves the people who use drugs, versus what and what kind of detriment, in fact, those that have in the community. But
right. The lack of coordination and communication, it's not the program, it's the administration in terms of the coordination and being receptive to hearing what the community's concerns are so that they can be addressed. Not to mention to Tracy's point earlier, the oversaturation and the lack of appropriate planning across the city to have diversity across all communities for access. So we're clear that there is a huge distinction between the two, and that as we are continuing these conversations, that we're able to create that space around administration and coordination and the differential so that people can still access services who need them.
Paul, wait, take it. And I'm sorry, I kind of I just took up that comment. It's a bit outside the scope of this presentation, but thank you, Deborah, for making that additional clarification.
No problem. Chaplain, I see your hand is raised. Dr. Gale.
You're on mute.
Okay, maybe.
Hello?
Yes, there you go.
Thank you. I want to make a point, and I'm a veteran, and I concern myself with what adversely affects veterans. And at first I wasn't going, at first I accepted, or I didn't accept, let me change that. At first I didn't accept Dr. Badger's fact that she questioned the statistics. Because at first I said, well, if we look at the negative, then we have to accept the positive. But when I looked at the criteria for what they said was the police equipped, what criteria are they accepting as police being equipped? That's the first thing that comes into mind that I would question. The second thing is, where is the outlier for veterans that come home from a war zone already with PTSD and mental health conditions? I am 4 generations veterans. My son is a veteran. My late husband was a veteran. There is a veteran outpatient clinic on 125th Street. They know that they can dial 988, press 1 and get help. I need to know if there was a statistic that outliered them, put them in a separate category. And then lastly, where this policy, when I heard of this policy that the police, who are, in my opinion, cannot be qualified, they don't have the equipment to be qualified, are going to round up people and put them in a mental health facility to be evaluated. Where is the outlier for veterans who could always go to the VA in the Bronx, or the VO on 23rd Street in Manhattan, or to the clinic on 125th Street? So it's a conundrum that doesn't settle itself for me. Thank you.
That is an excellent point. I think your point, whether or not some of these findings are similar or differ for veterans, is a very valid one. Unfortunately, we did not have enough veterans responding to the survey, and this was not targeting veterans. So there is no way for us to know whether or not there are differences from this survey. Certainly, I think it is a very interesting research question, whether or not veterans in the Harlem community, what is their perception of policing in Harlem?
So Pedro, what I will also do is reach out to Wendy McCullen at Black Vets, who's located in Brooklyn but does citywide work, to see if there is data on that information as one of our partners to follow up with. And I'll put that when we do the frequently asked questions, we'll include that information also as a support.
That's wonderful. Thank you, Deborah.
I know we're coming to a close. I just want to thank you all for taking the time and the energy and allowing us to share the information. As you can see in the chat, there are some webinars that are coming up because we, as the public school of public health in Harlem, we want to continue to center the concerns that the community brings to us and being able to create that space where academic, elected officials, community members, community-based organizations, and advocates can come together to have positive conversations about the data and hopefully come up with solutions and recommendations that we can put forward as a community as whole. These conversations are not easy, nor are they a one-shot deal. And so what we will continue to do is share the information. If there are things that you feel that we should be looking at in ways that we can help this conversation move forward, please feel free to reach out to me. We'll also be putting up a closing poll so that we can help to evaluate this conversation. And know that in a few days, you will get the recording from this along with the slides as we promised. And we encourage you all to come and participate at the Harlem Strong Coalition as we are looking to launch that in February as we begin to take this data along with the data from our surveys to really begin to think about how we begin to make changes in the community. So Priya, if you would put the poll up. I just want to thank all the folks in the background, Priya, Claire, Sam, Pedro, all the others who have taken the time and the energy to create this webinar. So thank you very much. Happy 2023. Please be safe. You see I have my mask still hanging and still using. So I encourage you, if you're going indoors, please think about those that may be more at risk. Be safe, and thank you very much. Appreciate you. Pedro, Sam, anything you'd like to close with?
No, just thank you for the opportunity.
Yeah, I want to thank directly Deborah. I think it is an honor to me to be, I'm a recent professor at the School of Public Health. I have been working at CUNY School of Public Health for 3 years. And I have to say, there is a critical component to any School of Public Health to be embedded and be part and supportive of the community. And I want to say I admire Deborah's work in making that solid bridge between CUNY SPH and the Harlem community. And I want to thank Deborah for allowing me to present our current work, and looking forward to work with community members in the future. So thank you.
My pleasure. We're lucky to have a dean who believes that the community should be centered in our work and has given us that charge. So you will hear from us more frequently, you will see us, you will feel us, and if we have information that we can share to help move the agenda, please know that we're here. Sam, anything you want to close with?
No,
Got
just
it?
I just want to add, if anyone has any questions or suggestions, please feel free to reach out to us. We're always available on email and happy to chat more.
Thank you all. Have a great day. Be well. Thank you.
Bye-bye. Thank you.